In the second module, we'll be looking at the macro level of the brain and how our lobes, and that is our cerebral cortex, facilitates the learning process during our first 12 months of life. Some of the ways we can confirm our understanding of the role that different parts of the brain have on learning and on thought process and in behaviors have been confirmed through different brain scanning techniques. So we'll start off by looking at a few neurophysiological methods, looking at the EEG, electroencephalogram. This is basically a device that allows us to record and monitor electrical activity in the brain through these electrodes, which are these little stickers. And typically they're in a skull cap that fits over the head, and as these electrodes, these little stickers, pick up electrical activity in our brain, that sends some type of pattern, a graphic pattern, onto a computer or a paper if printed, that basically allows us to see what type of activity is occurring in our brain when presented with different stimuli. Another one that is also commonly used is what's known as the fMRI. And the fMRI is a three-dimensional computer-generated image. By computer-generated image is what we mean by CGI. And it basically allows us to view the brain structure and activity as, again, is exposed to different types of stimuli. For example, if I were to be interested in seeing what type of activity occurs in your brain when you eat chocolate, I could put you in this device and then monitor your brain activity from the minute you receive the chocolate to when you are eating and tasting the chocolate, and maybe even thereafter, to see how long the effects of that stimulus linger in your brain. We make use of different powerful magnetic fields that allow us to view the changes in the brain as it occurs in intervals of 1/10 of a second. And this is seen and captured not with electricity as the EEG, but it is depicted through blood flow. And blood flow basically is what brings about different levels of oxygen into the brain that signifies that their brain is active whenever stimulated with different items or pictures or smells or anything that could activate the brain. The PET scan is another one that shows biochemical activity similar to the fMRI, and this is basically going to show some type of activity in the brain at any given moment through a highlighting, if you will, of the brain. The highlighting, as you will see in a few, basically paints the brain in a different color, which signifies that there is some brain activity. This radioactive liquid is typically injected in one of the arteries on the side of the neck, and that basically acts as glucose, which is able to get into the brain and highlight or change the color of the brain part that is active. And lastly, the NIRS, the near infrared spectroscopy, is another one that is used to spy on the brain and understand it, but this one is the one that is most adequate for infants and toddlers. The reason why there's one specifically for children of this age is because all the previous methods require that a person lay still for an extended period of time. We know this is difficult with infants and toddlers as they're often fidgety and they're moving around. So because of this in here, this particular method would allow us to study parts of the cerebral cortex. Please note that it is not possible to study anything beyond the cerebral cortex, and we'll discuss what that is in a bit. This only measures the blood flow and oxygen while the child is stimulated, again, with pictures or different lights. And that is one of the flaws. Again, the focus on the cerebral cortex and the inability to examine the central core, also known as the old brain. It's one of the issues. Here you can see three different methods At the top, number 1, we have an fMRI, in which an individual's biochemical activity is monitored when stimulated with different things. Here you have the PET scan is number 2, and you can see the different colors in the brain are brought about by that radioactive liquid we discussed earlier. And here you have the NIRS, in which the individual is exposed to different lights here in this square-like thing, and then the baby, the infant, is exposed to it, and allowing us to see what type of activity is occurring in the brain, if any. The cerebral cortex is basically what's known also as the new brain, and whatever you see colored in this picture is basically what the cerebral cortex is. The beige color of the brain, which is from here and over here, and even some that we are not able to see that would basically be around here, that is basically considered to be the old brain or central core. The old brain is called that because it is found in reptiles and other animals that are believed to have been here longer than humans have. Adhering to the evolutionary perspective, the more we evolve, the more cerebral cortex we have. And that is basically where we control some of the higher executive functions of thought process. So as you can see in here, there are 4 primary lobes. And lobes are just ways in how we call different tissue. You can see here the green is basically the occipital lobe. And the occipital lobe is involved in vision. Our ability to see basically comes from light entering through the eye and then going through the thalamus, which eventually ends up toward the back. And that's in the occipital lobe. The parietal lobe, which is up on top, has to do with sensation. So when you feel something in your body, and other senses are also processed there. You have the temporal lobe, which is the purple component here, and there's hearing that's primarily processed there. And then we have the frontal lobe, which is basically this grayish, bluish area in where we process body movement and coordination, as well as decision making and thought process. And then you have a prefrontal cortex here that is also believed to be associated with decision making and personality and filtering of different things. So keep these 4 lobes in mind as we explore the future slides. Something you have to be aware of the cerebral cortex is that when we are in our mother's womb, and even once we are out, once we are already babies, no longer fetuses, the cerebral cortex continues growing. And in fact, it's the last part of the brain to stop growing. Typically, it reaches the full size of an adult by adolescence, and then in middle adulthood, it will start decreasing in size. This is basically reactive and responsive to the environmental influences that you and I are experienced to. So again, a baby who is stimulated, a baby whose parents take them out for walks, who expose them to different things in there, are going to allow for synaptic growth or synaptic connection, and as a result of that, their cerebral cortex will be expanding and reacting well. A child who is neglected and not exposed to various stimuli is likely to experience the opposite of synaptic growth, which, if you remember, is called synaptic pruning. We find that the frontal part of the cerebral cortex is involved in morality, decision-making, language, and that there is a lot of synaptic growth typically from late infancy through the preschool years. It is during these 4 or 5 years that we see children acquire skills that are associated with language, morality, and decision-making. Again, if there is the exposure from the environment. The prefrontal cortex is involved in the thought process. And one of the things you'll see in here is that as we are young, we often don't inhibit our impulses to say what we think. It's been said that children and drunk people always tell the truth. Well, we're not sure about drunk people, but children often can't lie, especially earlier in life. And that is because what they think, rather than be inhibited by our prefrontal cortex, is going through without a filter, if you will. As we start getting older, if we have thoughts that are probably not so pleasant or nice, we may think it, but we don't say it. And that is because our prefrontal cortex is inhibiting our thoughts, our impulses. It also allows us to reason better, and that is, according to Piaget, cognitive maturity that is being acquired not only through our aging process, but also through our environmental exposure. And we also start getting better at solving problems. This is all possible thanks to, again, synaptic connections and growth that is made typically throughout our entire life. But something we see in the prefrontal cortex is that for reasons that aren't necessarily clear, there is a synaptic growth that typically occurs from 2 months of age, and then it goes through points where there is a high synaptic growth at the prefrontal cortex, and then it fluctuates to not so high thereafter. The second most significant synaptic growth occurs in adolescence, and this is what's believed to be associated with our more mature decision making that is expected typically by adulthood. For many years, there were people who believed that we had two brains, and the reason why is because they would view the brain as a two-part component because of the division that exists across the head and separates the left and the right hemispheres. We now know that there's only one brain and that it is connected through this tissue that we call corpus callosum right in the middle. Nonetheless, there are individuals who believe that lateralization is responsible for our skills, our abilities, and our preferences. What lateralization is basically a dominance of one hemisphere, either the left or the right, for certain functions. If you are left hemisphere lateralized, then you're likely to excel at verbal competence, and in addition to that, you may process information sequentially, that is, one bit at a time. For example, if you are in the process of buying a house and you are lateralized on the left hemisphere, you are likely to look at every detail of the house. Last time it was remodeled, when the plumbing was done last, looking at the neighborhood, and various other aspects. Whereas if you are lateralized on the right hemisphere, you're more likely to be acting on an emotional process and then process also information as a whole. Therefore, if you are also buying a house, you may look at a house, and if you like the way it looks, you may make a decision as a one piece rather than one bit at a time. And as a result of that, we find that individuals who are careful buyers, some people argue that they're likely to be lateralized on the right hemisphere. And anybody who is a lot more cautious, then they're likely to be lateralized on the left. Regardless of whether this is held up in future studies or not, one of the things we know is that if you are in fact lateralized on the right, it doesn't mean that you can't be competent in verbal skills. You may still be able to excel, but it may just take a little bit more practice, as what researchers say. A very important aspect of understanding the way the brain works is something that we call plasticity or neuroplasticity. And that is basically the brain's capacity to adapt to new situations. We find that if you were to have an injury on your dominant arm, you would probably have to use the non-dominant arm, and that could bring about trouble, at least initially. You may not be able to brush your teeth well, you may not be able to eat comfortably, and writing would also be a difficult task. However, the more you practice, the better you'll get at it, and it's possible that you may get really good at it, as is often the case with maybe basketball players who initially may have only been able to do a layup with the right hand, but with practice and because of the brain's plasticity, the brain adapted to them being able to do layups with the other hand as well. So neuroplasticity is something that gives us hope, and there's a lot of interest in understanding this, as it is believed to be deeply rooted in our capacity to learn. Exposure to environmental stimuli is essential for a high-functioning or well-functioning body. We find that if individuals are deprived of light after being born, it's possible that there could be vision impairment that could be permanent. A lot of studies have been done with other animals, including kittens, in which they were born with healthy eyes, but they were kept in dark boxes or dark rooms. They were fed and treated fairly in every other aspect, but they were not allowed to be exposed to light. And when they were deprived of light, they basically would develop a lot of vision problems later in life. Some of them having severe blindness because the retina has not yet fully developed. If you remember from previous slides, our eyes continue developing later and after we are born, and it is through light and exposure to light that we develop these photoreceptor cells in our retina. The language is another component that it needs to be present for us. Even though we're not able to produce language right away, it is important that we are exposed to language. And we find that there's often this critical period where children are often very receptive to different language cues. And if we do not expose them to that, we don't talk to them, then it's possible that they may not ever master the speaking abilities. There's this very sad and troubling case of Jeannie in the 1960s, who was a child who was born with some mental retardation. Her father, who was very close-minded and ignorant about what mental retardation was, viewed her as a waste and as a burden. And he, in fact, was ashamed of her, and what he did is basically neglected her. He was very abusive toward his wife, and so little Jeannie, from the age of 20 months up until the age of 13 years when she was rescued by social services, was not exposed to interacting with her family. They would take food to her once a day and leave her there to basically take care of herself. And when Jeannie was rescued from that home, unfortunately, despite the speech therapist and psychologist, she was never able to fully master the grammar skills. Therefore, allowing us to understand the importance of exposing children or stimulating children to different types of stimuli throughout life, but particularly shortly after birth. Here you can see the different changes in sleep and wakefulness from newborns to toddlerhood and early adulthood. What we find is that in order for us to sleep well, hormone that is secreted naturally by our bodies, melatonin, is needed. This is typically produced in mid-infancy. Prior to that, they actually sleep just naturally, and then after that, we kind of require that hormone to be present so that you and I can sleep well. One of the ways we can make children sleep better is by exposing them to sunlight at noon. And what we find is that typically when they're exposed to sunlight at noon, they often sleep better at night. To understand how we grow, it is important to look at the heredity factors, and that is basically what we get from our parents. If we come from parents who are tall, then naturally we have a greater predisposition to be tall ourselves. However, that's not the only thing that's important for growth and height. As we look at environmental things such as nutrition, we start seeing that the organs and the brain are benefiting directly from our nutrition. Therefore, just eating by itself would not suffice for a healthy physical growth. It would require a good nutrition with the proper nutrients, minerals, and protein that's associated with growth. There is no substitute or anything that compares to breastfeeding. Breast milk is suited for infants in various ways. Not only do they usually prefer the taste, which tends to be sweet, but it also packs all the nutrients that are essential, assuming that the mother is healthy and capable of breastfeeding. We find that individuals who consume breast milk often have less of a likelihood to suffer from respiratory and intestinal infections. And we find that because of various social trends and customs and cultural views, we find that breastfeeding is a practice that's most common among educated women. We find that typically about 74% of American mothers breastfeed, but half of the 74% typically stop after a few months. And that is because of the demands of maybe going back to work or various other responsibilities. Whereas in other parts of the world, there are people that breastfeed long past the age of 2 years of age. And while that may seem extreme in America, in some other places it's not. It's the norm. One of the benefits of taking breast milk is that it is easily digestible. We find that infants typically, when are breastfed, they would want to eat every 1.5 to 2 hours. This, of course, represents a difficulty for mothers who may be sore from just breastfeeding, and also it could be somewhat uncomfortable for them. However, when children don't eat breast milk, they often are fed every 3 to 4 hours. What this is doing is that it actually may delay their metabolism or slow it down. If you've ever heard of anything about diets, you may remember that in order for you to lose weight, you need to speed up the metabolism. And that is acquired by eating more frequently. So when we are often feeding babies in the bottle, their metabolism is actually being delayed or slowed, and this can bring about weight gain in the future for children who are bottle fed instead of breastfed. In addition to eating and proper care, it is essential that a child be in an emotionally stable place. Surprisingly, a child who is neglected or who lacks affection often is smaller than their other age mates. We find that if a child is depressed, it can be seen through abnormal feeding behaviors. Sometimes these poor infants would suck poorly when they're stimulated with the bottle or with the nipple, and when they suck poorly, then they're not really getting a good amount of food into their system. Also, sometimes what we see with individuals who are depressed or lack affection or neglected is that they may vomit, so a lot of the nutrients are not retained. So in order for a child to grow in a healthy fashion, it is important that there be an emotional stability and care. Neglected children are often below age-related growth norms and are often emotionally withdrawn. But if treated early, these infants often catch up in growth and in size. The next couple of slides go back to something that was discussed earlier, and that basically is touched again here as learning because of the result of stimulation through the environment. So please note that children learn things through classical conditioning, which was discussed in previous slides, so please review that. Children also learn through operant conditioning, again, which was discussed in previous slides, so please take a look at those to understand how a child's physical growth enables them to learn, and these two theories seem to be at the forefront of understanding how we learn as infants. Some of the ways in which we measure how we are learning with individuals that may not speak or react, such as an infant, is through habituation process. When you are habituated, when you've habituated to something, you've gotten used to that. And this is something that can be seen through the typical game of peekaboo for children. A newborn or someone who's never been exposed to that would find that very amusing and laugh with a lot of feeling and a lot of intention there. However, as they do this 30 or 40 times, they begin to decrease in their response. And so what was originally a laughter, intense laughter, begins to be a little bit less and less. And that basically is a sign of learning. The child has learned that this is something that is occurring, it's no longer amusing, and they've habituated, which once again is a symbol or a reflection of learning. Imitation, as we see, we discussed earlier with mirror neurons, is also another way in how we could assess learning with these individuals. So when a child copies the behavior of another, earlier in life it's believed to be associated with mirror neurons, and it is an automatic response. But as we get a little bit older, we start seeing that they do not just do it automatically, but they begin to imitate very selectively. They now start picking the things they want to imitate, and they neglect what they do not want to imitate. As social beings, our ability to move brings about a lot of benefits. And that is that a child who is able to crawl and walk and do things, they often get reinforced. You may not remember this because of what's known as infantile amnesia, but when you were younger and you took your first step, assuming you grew up in a loving family, there was a lot of joy and a lot of cheer for you for doing these motor skills that we now take for granted. So these motor achievements, especially earlier in life, would bring about very powerful social responses that are likely to make you feel appreciated and loved. So newly walking babies are often more attentive and initiate social interaction, and this of course allows for them to have a strong social bonds and circles, which may allow for them to polish their cognition and thought process, as well as their ability to communicate in verbal language. Please note also that gross motor skills are basically that which help an infant get around environments, such as walking, crawling, and standing, and fine motor skills are basically smaller movements, such as reaching, grasping, or buttoning up your shirts. As adults, you may be able to button up your shirt with one hand or two, but children initially do not have the fine motor skills sharpened, and it is brought forth again through stimulation and through exposure.